Welcome to Dr. Health Hub, where every episode begins with a doctor tip you can trust. Today we are talking about an infection that many people have heard about but still feel very unsure about: rabies. People ask the same questions again and again. What exactly is rabies virus? How does it spread? What should I do right after a bite? When do I need vaccine and when do I need immunoglobulin? And if I already finished a full course, do I need more shots in the future? We will walk through all of this, step by step, in simple language. So let us start from the very beginning. What exactly is rabies virus?
Rabies is a virus that attacks the brain and spinal cord. If it is not treated before symptoms begin, rabies is almost always fatal in humans. Once the virus reaches the brain, it causes inflammation of the brain, called encephalitis. From that stage, most patients die within a few days, even in good hospitals. The important point is this: rabies is extremely dangerous, but it is also almost always preventable if we act early, with proper wound care, the right vaccine schedule, and, in some cases, immunoglobulin.
So this is a virus that goes straight for the brain, and if we miss the early window, we almost always lose the patient. That really shows how serious it is. Let us step back and look at how people actually get infected. How does rabies usually spread from animals to humans?
Rabies spreads mainly through the saliva of an infected animal. The most common way is a bite that breaks the skin. The virus in the saliva enters the small wound, then slowly travels along the nerves toward the brain. Less often, saliva or brain tissue from a sick animal can get into fresh cuts or into the eyes or mouth. Simply touching or feeding an animal, or touching dried saliva on fur, does not usually transmit rabies. Around the world, dogs are still the main source of human rabies. In some regions, bats, foxes, raccoons, and other wild animals are also important sources.
So a real bite that breaks the skin is the big danger. Now, people might ask, who should be most careful about rabies? Is it just veterinarians and travelers, or really anyone who lives around dogs and cats?
Anyone who is bitten or scratched by a mammal that might carry rabies should take it seriously. Some people do have higher ongoing risk. This includes veterinarians, animal handlers, wildlife workers, laboratory staff who work with the virus, and some long-term travelers to high-risk areas. These groups may need pre-exposure rabies vaccination. But it is not only about those jobs. Even someone who is simply walking on the street and is bitten by an unknown dog, cat, or bat needs proper evaluation. Rabies is not only a problem for people who work with animals every day.
Now I want to move from the outside to the inside. Suppose the virus is not stopped in time. What actually happens in the body? What are the main stages and symptoms that families should know about?
The first stage is called the incubation period. This is the time between the bite and the first symptoms. It can be as short as 1 to 2 weeks, or as long as several months. During this stage, the person usually feels completely well and may forget about the bite. Then comes an early phase that can look like the flu. The person may have fever, tiredness, headache, sometimes nausea or body pains. Many people notice tingling, burning, or itching at the bite site, even though the skin looks healed. After that, the virus reaches the brain, and we see the classic rabies picture. Some patients develop what we call the furious form. They become very anxious, restless, and confused. They may have muscle spasms and difficulty swallowing. They can develop a strong fear of drinking water or even seeing water. This is called hydrophobia. Even air blowing on the face can trigger throat spasms. Others develop a paralytic form. They gradually become weak and paralyzed, often starting in the bitten limb and then spread into the rest of the body. This form can look similar to other nerve diseases, such as Guillain-Barré syndrome. Once these brain symptoms appear, survival is almost always rare. That is why our main focus is not treating late disease, but preventing the disease right after exposure.
So the key message is to act while the person still feels fine, not when they are already afraid of water. If a patient comes to us already symptomatic, how do doctors make the diagnosis? Is there a simple blood test that just says yes or no?
In someone who is already symptomatic, diagnosis is mainly based on the clinical picture and the history of a bite or animal exposure. There are special tests that can look for rabies virus or its genetic material in saliva, spinal fluid, or a small skin sample from the neck. These tests can help confirm the diagnosis, but they may take time and they are not perfect. A negative test early on does not fully rule out rabies. For someone who has been bitten but is not yet sick, we do not rely on tests. If the exposure is risky, we do not wait for laboratory confirmation. We start post-exposure prophylaxis straight away.
That brings us to the part that really matters for families. Imagine someone is bitten by a dog or a bat today. They come home, maybe worried, maybe trying to ignore it. What should they do in the first minutes and hours after the bite?
The very first step is wound care, and it's more powerful than many people realize. As soon as possible, the person should wash the wound thoroughly with running water and plenty of soap. If they can, they should wash for around 15 minutes. This simple step removes a large amount of virus from the wound. After washing, they can apply a simple antiseptic if it's available. They should not use irritants like acid, chili, kerosene, or traditional powders. They should not close deep, high-risk wounds tightly unless a doctor advises it. Then, they should go to a health facility as soon as possible. At the clinic, the doctor will check what kind of animal it was, where the bite is, how deep it is, and whether the person has had rabies vaccine before. The doctor may also give antibiotics to prevent ordinary wound infection and a tetanus booster if needed.
So first wash, then get to a doctor quickly. Once they reach the clinic, the next big question appears. What exactly is rabies post-exposure prophylaxis, and when do we need vaccine and immunoglobulin?
Post-exposure prophylaxis, often called PEP, has three main pieces that work together. The first piece is the careful wound washing we already talked about. The second piece is rabies vaccine. For a person who has never had a rabies vaccine before and is otherwise healthy, many modern guidelines use a 4-dose schedule. 1 dose is given as soon as possible on day 0. Further doses are given on days 3, 7, and 14. Some countries still add a 5th dose on day 28 if they follow older schedules. The third piece is human rabies immunoglobulin, or HRIG. This is a ready-made antibody that gives immediate protection while the body is still building its own antibodies after the vaccine. It is usually given once, on day 0. As much as possible is injected in and around the wound itself. Immunoglobulin is mainly used for people who have never been vaccinated before and who have a moderate or severe exposure, such as a deep bite or a bite near the head, neck, hands, or fingers. People who have already completed a full pre-exposure or post-exposure course in the past are treated differently if they are bitten again. They are usually given only 2 booster doses of vaccine on day 0 and 3, and they do not need immunoglobulin because their immune system already knows how to fight the virus.
You mentioned that some places still use 5 doses instead of 4. Let us make this very practical. If a patient finishes a 5-dose course this year and feels safe, how long does that protection last, and what if they are bitten again next year?
A full course of rabies vaccine, whether 4 or 5 doses, creates long-lasting immune memory. For most people who are not working every day with high-risk animals, we consider them previously vaccinated after that series. If they are bitten again, even 1 year or several years later, they usually do not need the entire series again. They will normally receive 2 booster doses of vaccine on day 0 and 3. along with proper wound care. They do not receive immunoglobulin again unless they have serious immune problems and a specialist advises something different. For people with continuous high risk, such as laboratory workers or some bat handlers, doctors may check antibody levels or give booster doses every few years, depending on national and local guidelines.
A lot of patients and parents also worry about side effects. If someone gets a mild fever after the third dose of vaccine, what should they do? Should they pause the series or keep going?
Mild fever, tiredness, and soreness at the injection site are quite common with rabies vaccines. They usually settle within a day or two. In most cases, we do not stop the series. The person can rest, drink plenty of fluids, and use a simple fever medicine that is safe for them, such as paracetamol, after checking with their doctor or pharmacist. They should seek medical help if the fever is very high, lasts more than a couple of days, or if they have signs of an allergic reaction, such as difficulty breathing, swelling of the face, or a widespread rash. In those rare situations, a doctor will decide how to continue safely. But for a simple, mild fever, the key message is clear. Do not stop the vaccination on your own. Finishing the course is what protects you from a disease that is almost always fatal once it starts.
Earlier, you also mentioned pre-exposure vaccination. People hear about it, but many are not sure if they need it. Who should get pre-exposure rabies vaccine, and how long does it protect them?
Pre-exposure vaccination is mainly for people with higher ongoing risk of exposure. In many modern guidelines, it is given as 2 doses, on day 0 and day 7. This protects most people for at least a few years. If they stay in a high-risk job, they may later have an antibody blood test or receive a booster dose depending on local recommendations. Most people in the general community do not need pre-exposure vaccine. It is mainly for those whose work or travel plans put them in regular contact with animals that could carry rabies.
Before we close, I would like our listeners to take home a few simple do and do not points. If you had to summarize daily behavior around animals and around bites, what would you say?
There are some very practical things people can do. If you are bitten or scratched by a mammal, wash the area quickly and thoroughly with soap and running water. Then seek medical care as soon as possible, even if the wound looks small. Tell the doctor what kind of animal bit you, where the bite is, and whether the animal can be observed or tested. If your doctor starts a vaccine course, complete all the doses on the dates given. Also, keep your tetanus shots up to date and follow instructions about wound care and antibiotics. There are also things we should avoid. Do not wait several days just to see if the animal looks sick. Do not put chili, herbs, acid, gasoline, or other home substances into the wound. Do not stop the vaccine series because you feel better or because the bite looks healed. Do not assume that a bite from a pet is always safe. If there is any doubt, ask a health professional or your local public health team.
That is very clear and very practical. To help people remember, can you give one short summary of the main message about rabies?
Rabies is a virus that attacks the brain and is almost always fatal once symptoms appear. But if we act quickly after a bite, it is almost always preventable. The virus spreads mainly through bites from infected animals, especially dogs and some wild animals. After a silent incubation period, early flu-like symptoms can progress to agitation, fear of water, or paralysis. For people who are already ill, doctors use the clinical picture and special tests. For people who have just been bitten, we do not wait for tests. We start post-exposure prophylaxis with good wound washing, rabies vaccine, and immunoglobulin when it is needed. A full vaccine series gives long-lasting immune memory. If someone who has completed the series is bitten again later, they usually need only 2 booster doses of vaccine on day 0 and 3, and they do not need immunoglobulin. Pre-exposure vaccine is used for people with ongoing high risk, such as animal workers and some travelers. Daily prevention also means avoiding contact with strange animals, vaccinating pets where recommended, and seeking help quickly after any suspicious bite. The key message is simple. If you are bitten or scratched by an animal that might carry rabies, wash the wound well and see a doctor immediately. Do not wait for symptoms, because by then it may be too late.
Thank you for watching Dr. Health Hub. Do not forget to like, share, and subscribe for more trusted health tips. And remember, your health is your wealth. Stay tuned for the next doctor tip you can trust.